Hello, my name is Lois and today I'm going to be talking to you through my presentation all about the roles and the responsibilities of a midwife. Firstly, throughout my presentation I will be talking about the roles and responsibilities of a midwife and the recent changes and the impacts this has had upon them. I will then go on to talk about the impacts of the midwife in meeting the physical, social and physiological needs of a woman and their families. Then I will be discussing the roles of the Nursing and Midwifery Council in relation to the midwifery practice. I will be analysing the implications of the code on the midwifery practice and the role of the midwife. Then there will be an explanation of the needs of the effective communication for the multidisciplinary healthcare setting. Then lastly, there will be an evaluation of the effectiveness of the multidisciplinary approach in the healthcare setting. The roles and responsibilities of the midwife. The role of a midwife is to provide care and support to women and their families while pregnant, throughout labour and during the period after a baby's birth. A midwife will mainly deal with pregnant women, providing professional support and advice. They are the main contact for women, providing evidence-based information and helping mothers make informed choices about the options and services available throughout her pregnancy. Nursing and Midwifery Council quoted that the role of the midwife is to provide skilled, knowledgeable, respectful and compassionate care for all women, newborn infants and their families. Midwives work across the curriculum for pre-pregnancy, pregnant, labour, birth, postnatal and early weeks of the newborn infant's life. This includes the woman's future of her reproductive health, well-being and decisions, and in promoting very early child development and the parents transitioning to parenthood. I have outlined some main responsibilities. These are providing full antenatal care including parental classes, clinical examinations and screening. Identifying high-risk pregnancies. Teaching new and expectant mothers how to feed, care for and bathe their babies. Working with women from a variety of backgrounds, understanding how to communicate and offer mother and their families the best support. A midwife will need to be confident enough to communicate with different people from various religious backgrounds. Some people and their families may be homeless, socially excluded, have disabilities or may be very young. Understanding the emotional, physical and psychological process of pregnancy and birth. Not all pregnancies go to plan, so midwives will need to offer support and advice on stillbirth, miscarriages, termination, neonatal deaths and neonatal vulnerabilities. The recent changes and their impacts. A national maternity review was commissioned in 2016 known as Better Births. This was to put in place over in the following 5 years. The idea of this was to further and improve care of the midwives. Their 7 main areas are focused on personal care. This focuses on a woman and her baby and also her family. This is based around the needs and their decisions. Community of care. Better Birth set out a version for maternity services across England to become safer and more personalised. Better postnatal and parental mental health care. This is to address the horrific underfunding and provision in these 2 vital areas, as it can have a significant impact on the life changes and the well-being of the woman, baby and family. The payment system. This is that it is more fairly and more precise when it comes to providing and delivering different types of care to all women, while also supporting commissioners and commissioners for personalisation, safety and choice. This is also to make care safe with better outcomes. Safer care. with professionals working together across boundaries to ensure rapid referral and across the right care in the right place. Multi-professional working, breaking down barriers between midwives and other professionals to deliver safe and personalised care for women and their babies. Multi-professional learning should be a core part of the pre- and post-registration training for midwives, and so that they understand and respect each and other's skills. And lastly, working across boundaries. To provide and commission maternity services to support personalisation, safety and choices, with access to specialised care whenever needed. This report also recommended that the NHS seeks volunteers locally to act as early adopters to test the module of care set out for the report, determine which flexibilities are required, and identify the most viable solutions for long term. Into Saving Babies' Lives Care Plan. In 2017, a programme called Saving Babies' Lives was designed and implemented to help reduce infant mortality rate. There are 4 aspects of the campaign which are all evidence-based and believed to be the best practice. These are as follows. Reducing smoking in pregnancy. There has been lots of research that involves the effects of smoking in pregnancy, and they can have effects on a newborn baby. Risk assessment and surveillance for fetal growth restriction. There is a lot of evidence that suggests fetal growth restrictions is a leading cause of stillbirth. And lastly, raising awareness of reduced fetal movement. Excuse me. The mother will be given an information leaflet by the 24th week of being pregnant. This will include up-to-date guidelines all about the reduced movement and what to do if the mother experiences reduced movements. Lastly, effective fetal monitoring during labour. A midwife will undergo the necessary training, as the fetal heart rate monitoring is a tool to provide guidance on fetal condition. The midwife will ensure one-to-one support is maintained by having the midwife remain with the woman throughout labour. The impacts of the midwife in meeting the physical, social and psychological needs of the woman and their family. Meeting various needs of a woman and her family during pregnancy is one of the main responsibilities of a midwife. According to the Nursing and Midwifery Council, midwives respect and enable the human rights of women and their children. Also, their priority is to ensure that the care is always focused on their needs, views, preferences and decisions of a woman and the needs of a newborn infant. A woman will first meet her midwife within the first 10 weeks of falling pregnant. The expectant mother will be asked a variety of questions about the physical and mental health. Her weight and her BMI will also be checked and calculated. This will be all recorded in the woman's personal notes. If the woman's BMI is over 30, for example, she will be classed as a high-risk pregnancy. She will be referred to a dietitian who will then reduce any of her risks where is necessary. The midwife will also need to require looking into whether the woman has a history of postnatal depression or diabetes before, as this allows to build up a clear picture of the woman's background and her history. The midwife will make any referrals if needed to ensure that the woman's personalised care plan is in place. Next, the midwife will look into the woman's medical history, looking into any genetic conditions on the maternal and paternal side. This is to clarify any conditions that may arise. During antenatal appointments, the midwife will continue to meet the physical needs of the mother. The bump will be measured and the urine and bloods will be taken from the mother. The midwife will ensure that the mother and the family are kept informed on how and why various tests are needed. The midwife impacts the physical needs of the mother and the family by speaking with the woman about her options for pain relief during labour and birth, while also taking in the women's wishes and beliefs into consideration. The midwife will also discuss all the options of locations available to give birth and all the risks and complications that will come along with it. It is important that the midwife listens to the wishes and the needs of the mother, alongside ensuring the safety for the mother and her baby. Once the baby is born, the midwife will continue to support the mother in a variety of ways. These will include offering pain relief if necessary, stitching any repairs if they have occurred, and will offer any support with breastfeeding if necessary. At the 6-week postnatal check, the midwife will check any healing tears or areas that needed stitching when giving birth. The midwife will question the mother to ensure that she is being prioritised and the physical needs as well as her and her newborn baby. She will be asked about her sleeping, eating and her general mood. The midwife will act accordingly with the information that has been gathered. I will now go on to talk about the role of the Nursing and Midwifery Council in relation to the midwifery practice. The NMC is the body that regulates the nursing and midwifery profession. It is a registered charity that keeps a record of all nurses and midwives that are allowed to practice in the UK. The set and reviewed standard for training and education is as well as the conduct of the performance of the midwives. This helps to protect the general public as well as the midwives. The Nursing and Midwifery Council must also investigate any allegations made against a midwife or a nurse and act accordingly. The NMC has 3 major roles in relation to midwifery. These are as follows. Number 1 is education. The NMC sets standards for both nursing and midwifery education across the UK. Midwives need to receive a high level of education to ensure they can approve safe and effective care for mothers and babies. Midwives and nurses who successfully complete their education and training are put onto the register, where they will then need to re-register every 3 years. Also making sure that their education is up to date. Number 2 is conduct and performance. The NMC also sets the standards and issues the guidance of the conduct and performance of the midwives and nurses. To regulate this, there must be some rules for midwives that must be followed. The NMC states that a midwife must be capable of the following: meeting the essential and competent skills within their practice, making sure the needs of the mother and the baby are the main priority. Number 3 is fitness to practice. A midwife must ensure that they are fit to practice with keeping up to date with relevant knowledge and training. The NMC is responsible for investigating any allegations made against a midwife or nurse and has the power to remove them from the register for a set period or permanently if required to do so. I will now go on to analyse the implications of the Code of the Midwifery Practice and the role of the midwife. This code was created by the NMC and made effective on the 31st of March in 2015. All nurses and midwives are required to uphold the professional standards of the practice and the conduct that is set forth the code. This code has 4 main sections outlined to duties that midwives and nurses are expected to perform. These are: number 1, prioritise people. Number 2, practice effectively. Number 3, preserve safety. And lastly, number 4 is to promote professionalism and trust. Midwives must ensure that individuals are receiving care, and respected. Their rights are honoured and any discriminatory attitudes are challenged. The physical, social and psychological needs of a woman and their family used in the midwife service must be continuously assessed throughout pregnancy till after. To practice effectively, a midwife must ensure that they are up to date with current research and guidelines, as well as working clearly and cooperatively with their colleagues and analysing with any other services when necessary. It is vital that the midwife keeps clear records of any decision made and do so with the full acceptance and that they are responsible for the outcomes. The code states that midwives at all times must preserve the public safety. Midwives are required to promote professionalism and trust accordingly this part of the code. They should offer examples of the integrity of leadership for others to follow, as well as show a personal commitment to the standards of conduct outlined in the code. These include to always uphold the reputation of the professionalism, maintain the status of the licensed nurse or midwife, participate fully in all investigations, observe all investigations, professionally address any grievances raised against them, and lead by example to protect people's wellness. The explanation of the need for effective community in multidisciplinary healthcare setting. The multidisciplinary healthcare setting brings together health visitors, nurses, doctors, social workers, pharmacists, and midwives along with other specialists. In midwifery, effective communication ensures that information is shared so that the team can work towards a common objective: the safe and effective care for the mother, babies and families surrounding them. Each member of the multidisciplinary team oversees providing the service or treatment in which they specialise, and they frequently have a variety of skills, ideas and experience that they can contribute to in the group's discussion. However, they might not all have the same communication preferences or styles, necessarily adapting for the team to achieve their desired outcome. The evaluation of effectiveness of a multidisciplinary approach in the healthcare setting. The patient has access to a variety of healthcare professionals who are all experts in the service provided. The patient's care plan will be a lot more grounded and the custom fitted to them. This is possible to expedite approvals, minimise treatment delays and reassure that the patient and their health and safety are prioritised. Lastly, positive working relationships can result in a happier employment and improve patient outcomes when there is a sense of utility among the team members. However, there are some disadvantages to using this strategy in healthcare. The end goal is more likely to be achieved when the team all works well together. On the other hand, if one member of the team does not stick to their job, like making the right referral quickly enough and not communicating well, it can hurt the whole team's progress and put off the patient's treatment. In conclusion, recent changes such as the declining number of practicing midwives, the COVID-19 pandemic and funding all have been impacted at the roles and responsibilities of the midwife. The NMC regulates and protects the public by enforcing certain standards and codes. Effectively, verbal and non-verbal communications is essential when working as a midwife with the MDT, so that a holistic approach can be used to treat the patient appropriately. Consideration of different learning needs of the patient should be recognised. On the whole, the MDT can be very effective. However, there has been cases where there has been a breakdown of communication that has led to devastating results for the patient or the service user. I would like to say thank you for listening to my presentation today all about the roles and responsibilities of the midwife.